Welcome to Thursday's edition of COVID-19. The daily tally remains little changed today on the 400 level, and a new study shows seasonal factors may aggravate the situation. Now, we have details on this later on the program. Here first is the broader pandemic coverage. So let's begin here on the local front for this Thursday.
Sunny, hardly any change from Wednesday's figures. The country reported 430 infections this Thursday, including 419 domestic transmissions. And in 430 days since the first COVID-19 case was confirmed here in Korea, that's in 1 year and 2 months, the country has hit 100,000 accumulated infections. So that's roughly 230 a day. But we had better days as well as worse days. And currently, we are having higher numbers than that average. With a third wave of the virus still lingering in the country, the capital region is the most affected place in the country. We're seeing almost 150 in Gyeonggi-do province and around 130 in the capital, Seoul. And again, some 30 infections down in Gyeongsang-Namdo province. Now, the exact number as of 12 a.m. stands at 100,276 with 1,709 COVID-19 related fatalities. When we take a look at our daily developments now, apart from this one day when we had a drop to the 300s, 400s are dominating the daily tallies. And with that, the average number of daily infections in the past week stands at 426, and the average for domestic transmissions is at 410, which meets criteria for level 2.5 social distancing measures. Now, currently, the metropolitan region is under level 2 social distancing measures, and the rest of the nation under level 1.5. So the health authorities are expected, very likely, to extend social distancing measures when they make an announcement on Friday. And next are vaccination updates. We had over 28,000 vaccinations yesterday, which raises the total to around 733,000 people who received their first shot, and also almost 2,700 who got their second shot of the vaccination.
I see. Meanwhile, so on the international front, a growing number of countries are seeking to tighten their social restrictions.
Right, Sunny. Belgium, for instance, has reintroduced strict measures, including school closures and also limits to access at businesses, non-essential businesses, that is. That'll begin on Wednesday and is expected to be in effect until late April. Also, Germany has extended its strict rules until April 18th, but Chancellor Angela Merkel has canceled a nationwide lockdown over the Easter holidays, acknowledging that that announcement came at too short notice. Let's now take a look at the numbers around the world. We also have Italy and France under strict measures, also especially over the Easter holidays, with some 4.3 million and 3.4 million infections. And the U.S., meanwhile, at 30.7 million cases. Let's take a closer look at the daily increases here. The U.S. here, over 67,000 infections, and a really big surge here in Brazil with over 90,000 cases. Also serious situation again, France, with over 65,000 infections reported in the span of 24 hours. And last but not least, the total number of infections stands at 125.4 million. And those are the updates I have for now. I'll be back in a bit after the government briefing. Sunny?
All right, so thank you for now. Back on the local front, Korea's inoculation campaign is currently being driven by vaccines from AstraZeneca and Pfizer. Now, in this next corner, we take a look at the latest findings with regard to Pfizer's product. I have Lee Kyung-eun here in the studio with me. Welcome, Kyung-eun.
Hi, Sunny.
Right, so what are the common side effects linked to Pfizer's vaccine?
Well, Pfizer's vaccine can trigger side effects just like any other vaccines, including the most common flu shot. The most typical side effect includes soreness in the arm. You may feel pain, redness, and swelling in the area where the shot was administered. Flu-like symptoms can also appear, including fatigue, headaches, muscle pain, chills, fever, and nausea.
I got the shot on my left arm. I didn't feel any flu-like symptoms like fever or chills, but I did experience muscle pain in the injection area for 2 days, so much so that it became difficult to even lift my arm. My colleagues also reported similar symptoms.
Experts say these side effects are natural signs of your immune system being activated. When you get the vaccine, your body tries to fight off what it believes to be a foreign agent, during which inflammatory responses like fever occur. Soreness in the arm can be attributed either to the needle itself or inflammatory reactions in the area due to chemicals contained in the vaccine. However, these symptoms usually disappear within 2 days, and painkillers can be used for comfort and relief.
I see. Now, Kyung, I hear side effects from Pfizer's vaccine may be more intense after the second shot.
Yes, data suggests that the side effects are more common in the second shot. Even though the composition of the vaccine is identical for the first and second. As you can see on this chart, the second shot is associated with a greater frequency for all kinds of the symptoms compared to the first. Muscle pain at 37% from 21%, chills at 35% from 14%. Report of fever nearly quadrupled to 16%. Because of this higher frequency of side effects, 45% of people who got their second dose used painkillers to ease their symptoms, compared to 28% of people after the first dose. The opposite is true for the AstraZeneca vaccine. Side effects reported after the second dose were milder and reported less frequently, and none of the recipients experienced fever.
We've been worrying that Pfizer vaccine side effects could be more pronounced after the second dose. The staff have given us painkillers just in case and told us to take them whenever symptoms appear, whether you got Pfizer's or AstraZeneca's vaccine.
Experts say the contrast in side effects are due to the different platforms that the vaccines are based on, with distinct ways of activating the immune system, some stronger after the first dose, while others more powerful after the second. The bottom line is none of the vaccines are any better or worse than the other in terms of safety.
Well, that is good to know. Now, Kyung-won, it's been found that younger people are more prone to post-inoculation discomforts compared to their older counterparts.
Yes, data suggests that side effects are more common among younger recipients. Some experts speculate that is because young people tend to generate stronger immune reactions. Remember, those side effects are signs of your body fighting off a foreign substance, in this case, the vaccine. And if you're young, your body's defense system puts up a powerful fight, which leads to more intense side effects compared to older adults who have weaker immune systems. But experts say experiencing more intense side effects do not necessarily suggest that the person has stronger immunity.
As of now, there is no proof establishing a link between the intensity of side effects and the strength of one's immune system. There are some people who are completely asymptomatic after all, so this can only be tested under lab conditions.
Right, one final question before you go, Kyung-won. I understand Pfizer is also working on a drug to treat COVID-19.
Yes, the U.S. pharmaceutical company said it is conducting a stage 1 clinical trials of a pill that COVID-19 patients can swallow when their symptoms first appear. This will be the world's first orally ingested medication to treat COVID-19. Right now, there are only a few treatment options available on the market. Experts stress the importance of treatments, saying it can be a complement for vaccinations, since it can take several years to vaccinate the entire globe, and more options are needed to treat COVID-19 patients in the meantime.
All right, Kyung-won, let's end on that positive note then. Thank you for being here.
My pleasure.
Right, up next, we are poised to join the regular briefing on the COVID-19 situation here on the local front for this Thursday. Right, I hear the briefing is yet to start, so while we wait for it to commence, recent findings show a greater transmission rate from parents to children occur within the homes. So do take care when you're in the domestic arena as well. The briefing is about to start. We'll come back to you afterwards.
First of all, we have Mr. Kwon Junuk with the explanation on the briefing. Let us now begin our regular briefing on the COVID-19 situation here in South Korea for March 25th. As of today, midnight, we have 419 new local infections and 11 new imported cases. The total caseload now stands at 100,276. And a total of 77,166 tests were conducted yesterday. And at the makeshift testing centers in the metropolitan area, we carried out 32,517 tests and confirming 68 patients. And we also have 508 more people being discharged, while 6,499 still remain in quarantine. And we have 111 patients with critical or severe conditions. We had 2 additional fatalities. I extend my deepest condolences to the deceased and the members of the bereaved families. And the updates of our domestic infections by region, here are the following information. We have 67.5% of the total cases being concentrated in the metropolitan area. And in Seoul's Songpa-gu district, we have a family and a medical center. We have 12 cases. And also in Songpa-gu district, in relation to a logistics center, we have 16 cases. And in Gyeonggi-do province, Suwon City, in relation to a social welfare facility, we have 11 cases being confirmed. And in Gyeonggi-do province, Ansan City, in relation to a family and a cultural club, we have a total of 10 people being confirmed to date. And next, in Chungcheong provinces, in Chungbuk, in relation to a sports club in Cheongju City, we have 17 cases. And a sauna in Daecheon, we have 59 cases being confirmed to date. And in Honam, in Gwangju City, in relation to a Donggu singing room, we have 11 cases being confirmed in total. And in Gyeongbuk province, in Gyeongsangbuk-do province, Gyeongsan City, in relation to a spa, we have a total of 22 people being confirmed to date. And Gyeongnam, we have in Busan Seogu district, in relation to a business operation, we have 11 cases. And also in Jinju City, in relation to a public bathhouse, we have a total of 230 cases. And Gyeongnam, in Gyeoje City, we have also, in relation to a nightlife venue and a company, a total of 162 cases. And in Gangwon-do province, Sokcho City, we have 39 cases in relation to a preschool. And in Wonju City, in relation to a health clinic, we have a total of 12 cases being confirmed to date. And moving on, here are some details on our clinical trials as well as R&D. The COVID-19 treatment remdesivir, as of 24th of March, we have administered the drug to more than 5,200 patients here in South Korea across 121 hospitals, and the Recurona drug has been administered to a total of 681 patients here in South Korea. And the plasma treatment, we are also having 42 cases that are being used right now under the approval of the Food and Drug Safety Ministry. And we also have seen the effectiveness of these therapies against the new variants, and also in increasing development of the neutralizing agent. And we have assessed for the 9 variants, and we have also included the UK variant and the South African variant to the subject. However, the the Brazil variant, that is, we will be carrying out further analysis at a separate time. And also for all of these cases and variants, we have seen that our therapeutic is not affected by the new variants. However, this also proves only effective in a cell level. So we need to also review the results that are disclosed by the drug makers based on their clinical information and clinical trials. And in the medical front, we would also like to ask for you to utilize these drugs upon the approval process. And as we vaccinate the the public here in South Korea, we have told you that we are doing a survey on the amount of antibodies developed among the people. And we have also been collecting these samples, and a total of 433 people have been collected as samples, and 216 have administered with the Pfizer vaccine, and about 227 had been administered with the AstraZeneca vaccines. And after their first shots, we are looking at their antibody development as well as the adverse reactions, and we are expecting our interim results by mid-April. And also, we have some details on the epidemiological investigations. Recently, our quarantine authorities have noted in Chungcheong province and also three other regions aside from the metropolitan area, we have been looking at our epidemiological investigation in Chungcheong, Honam, Gyeongbuk, and Gyeongnam provinces. We have been looking at these provinces, and all of them have a daily tally below the 100 mark, which is lower than the capital area. However, it has seen a slight increase after March. And looking at the last 4 weeks, we have seen that about 60% of these cases were related to cluster infections. And also we have seen that new variants from the US also have been spreading through the community there. And we also have seen sporadic cases of the cluster infections. And aside from this, we also have seen that individual cases and infections have also been on a rise. And by region, here are some characteristics. In Chungcheong area particular, we have the meat processing company or the manufacturing facilities and other business sectors accounting for about 50% of the total cases there. In Honam area, we have the cluster infections from the churches and also call centers and indoor sports facilities, which were all of the high-risk facilities. And in Gyeongbuk province, we had the social gatherings and also family gatherings after or before Lunar New Year holiday, which acted as the main culprit of major cluster infections. And in Gyeongnam province, we had the clinics as well as the seniors clinics and the welfare facilities, which were the subject of the cluster infections. And we also seen a cluster infection stemming from golf clubs as well as public saunas. And here in South Korea, we have the daily tally hovering around 300 to 400 mark. And in order to stabilize the situation going forward, we will be looking at the characteristics of the infection spreading at each of the districts and provinces. And we believe that based on this approach, we will have a tailored quarantine measures set for each of the different districts and provinces. And to this end, we will be cooperating with the local governments going forward. And we ask the local governments as well to do an intensified monitoring and inspection of the high-risk facilities, as well as some facilities that are prone to the COVID-19 infections. We ask you to also carry out a large and massive campaign for the public, and also carry out a massive and preemptive testing if you have any possible risks of further spread. So these have already been recommended to the local governments. And next, as for the high-risk facilities, we also have the churches being also the subject to major cluster infection. And recently, we have seen a decline in overall infection spread from these churches. However, next week we have the Easter holiday coming up, and we have analyzed some risk factors, and here are details. Starting from this year, we had about 41 cluster infections stemming from churches, and which also infected a total of 1,520 people in total. This has been on a clear decline. However, we have seen that the virus spread through small meetings, and also after the services, after the spread at these churches, the virus also spread throughout the local communities, through the workplaces and families as well. And we have seen that some people also, despite their symptoms, they visited the churches and have regular services, and also they engaged in small group meetings as well. And also there were some people who did not abide by these clear social distancing rules and the face mask rules. So once again, we highlight that if you have any clinical symptoms and if you have any suspected symptoms of COVID-19, please also get tested and please do not go to churches or other multi-use facilities. And we also ask the quarantine managers at each of the facilities to monitor the people's symptoms and conditions and also refrain from having gatherings after the services as well. So please take particular notice of these factors. And next, we have some updates of the Safety Eve report. Currently, we have had some of the breaches mentioned at the preschools and kindergartens. The teachers there did not have proper wearing a face mask. Also, some teachers gathered in group meals or for more than 5 people. And there were also people, parents, that is, who did not wear face mask when they went to greet their or pick up their children. And also there were musical classes which could have increased the risk of respiratory droplet travel. And we ask the parents to monitor these conditions of your children, and please do not let them go to preschools or in kindergartens if they show any clinical symptoms. And also please teach them and guide them so that they can wear the face mask in a properly manner. And also please guide them to have a proper washing of their hands as well. And we also ask the quarantine managers at these facilities as well to have a ventilation and disinfection on a regular basis, and also wear face masks on a proper basis as well, and also prevent any activities that increase the travel of respiratory droplets, and also carry out a regular guidance and education for preventing COVID-19. And here are our status on COVID-19 vaccination as of March 25th. We have 28,222 new people being administered with their first dose of COVID-19, raising the total to 733,124. And we also have 2,691 people who have administered with the second dose of their vaccines. And also we have seen that the vaccines have been completed for about 690,000 people for those under the priority group, the first priority group, and it reached about 81.8% of our target. And at care facilities, we reached 89% of our target and about 70% for the first responders. And at hospitals, we have 77.2% of the inoculation rate. And also, post-inoculation adverse responses have been reported, and accumulated number stands at 10,010, and a total of 78 new cases have been reported yesterday. A majority of them, or 9,893 of them, had mild or common symptoms after inoculations of any kind of vaccines. And we also had 93 suspected cases of anaphylaxis, with 3 additional cases, and 8 suspected cases of severe cases, including convulsion, and 16 cases of death have been reported. And here are also our last message to the public for the day. We are seeing a global spread of the COVID-19, and we are seeing a resurgence of the virus in Europe as well as in Brazil as well. And here in South Korea, for the past 2 months or so, our daily tally have hovered around 300 to 400, and we are not seeing a clear decline of our daily tally. And today, the accumulated number of our caseload has surpassed the 100,000 mark. Nevertheless, we are having a decline in the number of people with critical or severe conditions, or the number of fatalities. And lately, the reproductive rate has decreased slightly, staying below the 1.0% mark. However, on a global level and here in South Korea as well, we are seeing an increased emergence of the new variants. Moreover, globally as well, we are seeing more diverse types of these new variants as well. And here in South Korea, at daily facilities and churches, and as well as other places of worship, we are seeing another resurgence of the virus. Also, we are seeing an increase of people movement as as well. And we have a heightened and increased level of fatigue among the people with prolonged social distancing measures. This is what worries the quarantine officials here in South Korea, and the health authorities believe that primarily until mid-September, this is when we expect the herd immunity to develop among the senior citizens who are prone to virus infections. Until then, we need to also speed up our inoculation and contain the further spread of the virus. Here in South Korea, the health authorities are monitoring proactively the new variants. And today, in particular, we have mentioned a few words and additional words for the churches as well. And up until now, the leaders as well as the members of the country's religious circles have participated proactively in the social distancing measures. And we have seen a clear decline in the number of infections stemming from these churches. And they are also abiding by the quarantine measures in a large extent. First of all, I would like to extend my deepest appreciation for your cooperation. Nevertheless, we are seeing clear some infections and a resurgence of infections after the services. People have been meeting up for small gatherings and Bible studies. So once again, we ask for your consideration, and we urge you, if it's not necessary, we ask you to refrain from having group meals or having small gatherings after regular services. And here at this point in time, anyone here in South Korea should not go to school or work if they have any clinical symptoms. Rather, they need to go to the the screening center, that is, to get tested as soon as possible. Until you have your results of the test, please do not go outside, and also keep social distancing with your family members as well. Moreover, if you live with family members over the age of 65, or if you come into higher contact with them on a frequent basis, we ask you to also take more particular precautions of the quarantine measures that we have just mentioned to you.
기자님들 질의답변 시간 갖도록 하겠습니다. 오늘 방역과 관련된 질문.
Right, that was Kwon Junuk with Thursday's afternoon briefing. So, what did he have to say?
Well, Kwon had some analysis from the past 4 weeks when it comes to the characteristics of infections by region outside of the metropolitan area. So in Chungcheong-do provinces, there were mainly infections breaking out at businesses such as meat processing factories. In the Honam region, at high-risk facilities such as call centers, religious facilities, and sports facilities. In Gyeongsangbuk-do province, at social gatherings, and in Gyeongsang-namdo province at medical facilities as well as golf clubs and public saunas. And also, he mentioned especially vigilance today regarding religious facilities, especially because Easter is coming up, I guess, saying that there has been a significant decline in infections related to places of worship. So he thanked for the cooperation there, but there have been more and more small gatherings after official worships, for instance, Bible studies. So he called on extra caution there. And also some good news on antibody treatment, which seems to be effective on variant cases from the variants from the UK and South Africa, but there needs still more analysis regarding the Brazilian variant.
Right, I see. Okay, so thank you for that.
Thank you.
Now, we've been told that herd immunity secured through public inoculations will protect us from COVID-19. But what exactly is herd immunity, and how does it serve to keep us safe? We answer that question in this report.
With Korea's vaccination campaign progressing smoothly for the most part, there are growing hopes and expectations that the country will soon be able to reach herd immunity.
정부는 반드시 목표한 시점까지 집단 면역의 꿈을 실현하겠습니다.
Infectious diseases spread rampantly and unchecked in a population that has little to no immunity. But when a large enough proportion of the population are immune, either through vaccinations or previous illnesses, transmission chains are cut off and infections become much more limited. Korea has a stated goal of making sure that 70% of its population possess neutralizing antibodies through its vaccination campaign.
Usually, infectious disease with a high transmission rate have higher herd immunity threshold. Achieving the herd immunity would require people with immunity to reach certain threshold. So what is this threshold? We can calculate this by estimating what's called R0, which is an average number of people an infected person spreads the disease to, a completely susceptible population.
The basic reproduction number refers to the number of people that one infected individual is expected to pass the virus on to.
일단 이제 우리가 지금 늘 잘 알고 있는 70%의 국민이 일단 맞으면 집단 면역이 형성된다라고 할 수도 있는데 그 당시에 감염 재생산 지수는 당연히 2.0 이하라야 되는 것이고요. 그렇게 집단 면역이 형성되면 그 다음에는 어떤 현상이 생기냐면은 바이러스가 한 사람 이상한테 퍼뜨리지 못하게 됩니다. 그러면 바이러스가 병이 생긴 사람은 치료를 하고 한 사람 이상한테는 퍼뜨리지 못하기 때문에 바이러스는 점차 줄어들게 되겠죠.
Simply vaccinating 70% of the country's population might not be enough, given the other mathematical variables in play.
Scientists believe that vaccine would offer protection against the infection with an efficacy of 50 to 70% based on the limited data from clinical trials on the vaccines, AstraZeneca and Moderna vaccines. And if we take 50% of efficacy and assume that 70% of the population will be vaccinated, and we multiply these two numbers to get 35% of population that will be protected. And that number is much lower than the threshold level of herd immunity, which was 70%.
Though achieving herd immunity will help us get our lives back on normal track, it will not be an easy process, nor will it happen overnight.
집단 면역을 형성할 때까지는 시간이 많이 걸립니다. 우리나라는 아마 이번 겨울이 되어야 집단 면역 형성이 됐다라고 겨우 얘기를 할 수 있을 거거든요. 그래서 그 전에 우리가 방역 수칙을 안 지켜서 감염 재생산 지수가 2.0이 넘어가 버리면은 집단 면역 형성되지 않습니다. 70%를 맞아도 이 부분을 유념을 해서 코로나가 끝날 때까지는 끝나는 게 아닙니다. 그때까지는 그냥 이 방역 수칙 지키는 것을 생활 습관화 해서 조금만 더 인내를 하시고 다 같이 백신을 맞자 그렇게 말씀드리고 싶습니다.
We must remember that vaccines alone will not end the pandemic, and it is up to every one of us to be responsible and to be a part of the solution by practicing prevention in our everyday lives.
특히 이번 주부터는 벚꽃이 개화하기 시작하기 때문에 이동량은 더욱 늘어날 것으로 전망됩니다.
복구경과 산행 전후에 식사나 다과, 음주를 위해 마스크를 벗게 되면 감염의 위험이 높아집니다. 대화를 하실 때에는 가능한 한 마스크를 착용해 주시고 많은 사람이 모인 곳에서의 식사나 다과, 음주는 자제해 주시기 바랍니다.
The third wave of the pandemic here in Korea has survived the cold winter and is now entering the warmer months of spring, whose seasonal factors look to aggravate matters. Now, for more on this reality, I have Professor Oh Jae-won from Hanyang University with us here. Pleasure to see you,
Good to see you,
Professor. And we have Dr. Yu Byung-wook from Suncheon University Hospital. Good to see you again, Dr. Now, Dr. Yu, for the 9th straight week, Korea's daily tally has been hovering between the 300s and the 400s range. Now, we had been told earlier that the virus is more active during the colder months of the year, but spring is here and the outbreak is showing no signs of abating. How do you explain this trend?
Well, first of all, the March last year, we don't have that much the patient because we are worried about it. about the COVID-19. From the beginning, we don't know what exactly COVID-19. So we are just be afraid. We are trying to stay in home. Compared in mobility, so people are to the last year and this year in the same time in March, it's more than 7-8 times as more the population is then moves around. At the same time, vaccination is started. The people they feel safe. Feel safe is make us feel confusing because only the people are vaccinated in the hospital, the professional and health professional who need vaccinated to high risk persons. But in general, we're still waiting for. But the people, they feel that we are already saved when just begun of the vaccination. That's why the level of caution will be down. Also, characteristics of the COVID-19, silent spreading. So that cannot be tracings more than around close to 30%. Still, that goes around the Korean Peninsula now. That's why it cannot be down till like the 100 less.
I see. Which is why authorities here are warning of a fourth wave in late March or early April amid the presence of variants. Dr. Yu, what are your thoughts on this?
Well, so one expert, he warned to us that late of February, it could be reached to confirm the 2,000 cases COVID-19 daily in late of the March and early of April. Fortunately, we are now passing. So, but I believe still we have the little risk about it because variant yet can be, but variants doesn't make the big deal with this big number of this. Most of my concern is that people are moved. So we can compare the European and US Northern American territory. They having the Easter break, Easter holiday now. So such a number of the confirmed. Korea now, we are cherry blossom seasons. So people are relaxing. Also people are enjoying the hiking the mountain because usually after the ice breaking, people love to go to this spring, the flowering, the mountain hiking. But not only this, the people are gathering more than 5. So officially it doesn't allow it, but people are doing now. So, but you know what? So we cannot wear the mask. So this is the basic quarantine measure as now it goes. That's why we can reach any times more than 1,000 can be, not only the variant issues.
Right, I see. Meanwhile, Professor O, I understand you partook in a study that shows high pollen levels in the air raises the risk of COVID-19 infection. Could you tell us a bit about your study and its findings? Yeah,
actually, that is the huge and massive and international study, including the 130 sites in the 31 countries, and so including Korea. And so in that study, we found the very important clue to why the increasing nowadays is the pandemic, the COVID infection. And so we found the results from that study, and after 4 days over the high concentration over the pollination, and that they are increasing their COVID infection, the rate. And so that is a very crucial the fact to increasing the COVID infection in the spring time. And so that was the very important result from the all kind of countries that joined in our study.
Right. So it was a common result then?
Yeah.
Professor O, how does pollen make a person more vulnerable to COVID-19?
Yeah, actually, the pollen is generally aggravating the allergic disease, the kind of the allergen. And so they can make the aggravating the allergic rhinitis or asthma or the other allergic conjunctivitis. But yeah, the kind of pollen has the other function. And so they can weakening the immunity to the human to protect the virus. And so that means that the kind of pollen diminished the antiviral immunity in human, and can expose the pollen to pollen, and it can making the increasing the COVID virus infection, we thought.
I see. Dr. Yu, I believe studies also show a link between yellow dust and higher COVID-19 infection as well as fatality. Can you tell us a bit about this?
Well, I highly agree that Professor O's mentioned because I'm so impressed with what he described. But the measure I like to express to our dear the watchers, our the Arirang, because more easier, it's like the family medicines. So we have the limited immune systems, so like military troops. But this is kind of limited with resources. But our immunity is used up and the make up all to the exhausted to defend against the yellow dust or fine dust. That moment, if we are exposed to COVID-19 virus, another like allergen or kind of intruder or the invader, there are no way to defend. So that's why usually, so the yellow dust seasons and the high concentration of fine dust seasons, the respiratory systems disorder is more often. It's also linked with a high fatal rate of the upper respiratory systems infection like the pneumonia. So it's the same way. So right after the yellow dust attacks, 4 days after the COVID-19 increase, I'm so impressed with what Professor O explained it. I highly agree with what he mentioned because our limited immune system can be used up and then there are no way to defend against COVID-19.
Right, we become more vulnerable then. Meanwhile, Professor, what more can you tell us about the relationship between air pollution and COVID-19?
Yeah, actually, it's the two kind of a pathway. We worry about the two pathways. One is the fine dust, as you mentioned, the doctor you mentioned, and the fine dust means the particle matters. We call it the PM10, the PM 2.5. It's very important. The PM10 means the 10 micrometer, and so 2.5 micrometer means that they approach to the terminal airway, and so terminal airway diameter is the 6 micrometer, and so 2.5 they're too enough to reach the terminal airway, even in children, even in adults, and that kind of a situation that the fine dust, the high concentration, the fine dust, can affect the airway disease, such as pneumonia, asthma, or COPD, that kind of a disease that aggravated. And so the other way, the pollen, it can diminish the antiviral immunity. That is the theory is the background is from the Dr. Stefani, Gilles, from the University of Munich, Germany. A couple of years ago, she reported that kind of a pollen exposure can make it diminish the antiviral immunity. And so we thought the two kinds of pathway in spring. One is the pollen, the other one is the fine dust and the Asian yellow dust. It's a very important factor to affect the human health.
It is, it is. And Dr. Yu, based on what's been shared so far today, it's quite clear that ventilation is essential to limit the risk of COVID-19 infection. Do remind us about the importance of ensuring air quality inside or within enclosed spaces.
Well, under the yellow dust seasons, so people, they believe better to keep closing because we believe this helps the defense. But what Professor O mentioned, 2.5 something mean even we try to close the door and the window tightly, but micropollens coming too. But the problem is the floor air is stuck. There are more chance we can inhale it, having in the high concentration of yellow dust or fine dust. At the same time, if there are one person who are infected with COVID-19 who are ventilated, which means he can make the mixtures in the air with the development of the COVID-19. As you know, fine dust and COVID-19 is being very light, but it's not air, it's no airborne. So which means when it's stuck, it's be concentrated, but if it slowly, because gravity going down, but still there are. That's why the government, they highly recommend at least once in an hour, 5 to 10 minutes, and it's both way to the path through the ventilation should be done, not only for the yellow dust, at the same time, less chance of infected because of COVID-19.
Right. Meanwhile, Professor O, what are some personal prevention measures that can be followed this season to prevent oneself from COVID-19 infection?
Oh, actually, it's you have to protect the pollen exposure. There's one way to protect the pollen exposures that you have to close the windows, especially in the morning. especially the AM6 to AM10 is about a high concentration of the pollen. And so if we want the ventilation, you would open the window, so many the pollen come into in your home. And so you have to close the window at the time. If you want the jogging or exercise after work, after school, you have to take the exercise. And so even you have to take the drive, you have to close the window. And the best way, you have to take the KF97, 94, the mask.
Right. All right, so we have to have our masks on and we have to remember to ventilate after 10 o'clock in the morning.
Yeah, sure.
I see. All right, Professor, thank you very much for your thoughts, and Dr. Yu, thank you very much for your insights.
Okay. Thank you.
Right, a number of spring festivals are being cancelled amid the pandemic here and on the local front, that is, but organisers are hoping a containment of COVID-19 next year will allow for a resumption of these seasonal events. Thank you for watching.